Hello everyone, County Executive Mark Hackle, John Paul Ray, our Deputy Executive, to give you some updates on what's going on with the Corona crisis here in Macomb County. Where are we at with numbers? I know they're tapering off a bit, which is a good sign. Unfortunately though, there's still loss of lives associated with these numbers.
Mark, we're still looking at some stark realities with regards to the numbers. That plateau as far as figures go, over 5,600 cases now in the county, and unfortunately 614 deaths. Statewide, we've now ballooned over 41,000 cases and nearly 3,800 deaths. I think the thing that we're starting to see as those numbers continue to trend, as we're doing all the analytics on them, again, the recoveries keep increasing, nearly 1,900 recoveries now in the county, all available information in our community dashboard at macombgov.org.
So, you know, we're starting to see the spread is slowing, and that's a fortunate sign. We just talked to Bill Rodella from our health department and Dr. Lokar. They gave us kind of an update on what they see happening and kind of how it relates to whatever's happening within society. I know internally we've taken some precautions to keep people looking to work at different off-site remote locations, which has been helpful for us internally. But even externally, I think they applaud the efforts on behalf of what's going on at the state level to try to figure out how do you get people to stay home and limit some of these non-essentials from actually being open. And albeit controversial, I think it's kind of helped out quite a bit.
Mark, undoubtedly the protection orders that have been put in place by the governor, also how all the health departments across the state of Michigan have gotten that information out to not only protect the workplace, protect those congregative environments, whether it's our grocery stores, pharmacies, limit the operations of those non-essential businesses, but still provide carry-out and take-out options, has definitely flattened the curve and has given everyone that heightened sense of awareness that by doing those little things, the social distancing, some of the facial coverings, we're going to stem the spread of this virus. But I really thought it was interesting, as our health director Bill Rodella brought up this morning, kind of throwing out that analogy. We're in the second inning of a baseball game right now, and it's just being aware that this is going to be something that's going to be extended in the future with regards to the virus until there's some form of vaccine or active treatment out there.
And that becomes a concern, is this balancing of health and human safety versus the economy. Right now we're seeing it played out probably closer to home here with our state officials. Telling the governor they're no longer going to extend her state of emergency when we know we have an emergency. I'm trying not to politicize this issue, but I'm just going to kind of relate it to what we've got going here in Macomb County. There is a declaration, a disaster declaration, not only in this state but across the country. That's separate. That's recouping costs for funds supporting what we're dealing with this pandemic. So the declaration of a disaster is completely different than a state of emergency. The state has a state of emergency, allowing the governor, the executive office, to go ahead and reallocate resources, whether it's personnel, and kind of coordinate efforts with communities around the state. But with that, this governor has the opportunity also to, I guess if you will, impose upon business and the public some executive orders. And I think that's what's created some of this tension, if you will, because some folks don't like the fact that it's not regionalized throughout the state. We're more impact on Southeast Michigan. We should be a little bit looser on some of the guidelines in the northern part of the state. So understandably, there's going to be some tensions from people, whether it's business folk, legislatures, and with that, I think there was a swift determination made by the legislature, the House, and probably the Senate now, to say we're not going to extend the executive order. The governor went forward with another avenue to once again declare an emergency, and I think it's to give her those same powers and privileges to go ahead and do what she's doing and trying to figure out how she reduce the spread. So whatever's happening as a state is completely different than what we've got here in Macomb County. We've got the state of emergency for Macomb County. Unfortunately, the Board of Commissioners understands our need for that. It has nothing to do with imposing our, I guess if you will upon the public and or businesses within Macomb County. We're not giving them guidelines. We're not, I should say, we're not restricting them. We're not telling them what to do. They are given guidelines from the state as well as the CDC. We need those, I guess, executive order for us to say, we need a state of emergency here in Macomb County so that we can reallocate resources. Put people at remote work sites so they're not all congregated in their facility here, once again spreading if somebody has a particular virus. Making sure that we're coordinating efforts with local municipalities. We're that, if you will, that beacon. We're that conduit to work with our schools, work with our the hospitals to try to figure out each municipality in Macomb County, how do we get PPEs out there? If there's funding that comes our way, how do we distribute that funding? So our state of emergency is completely different, as I mentioned. We're not here trying to figure out what do we do externally to tell business how to work. We're here trying to figure out how do we work with one another and guide our personnel within. So fortunately, we're going to keep that state of emergency going so we can keep our employees safe, basically.
Mark, I think you've said it time and time again. We don't want to politicize these things. We're trying to figure out the best avenue so we can make our operations as efficient as possible. We can make sure that county government continues to be operational and there to serve the public, whether it's something that's necessary from an emergency response side as we're dealing day in, day out through our emergency response center, or it's something from county business side. Those are things that we're going to continue to track, scale in those things with the help of Andy McKinnon from our Human Resources Department, and see what that looks like, not only with regards to how we continue to serve the public, but continue to meet the challenges that we're faced with during this pandemic.
Yeah, it's again, there's a lot more time. This thing is going to play out, and so we are going to need the continuation of our state of emergency here in the county. We're not ready to drag our people back into work in the work environment we have. We like the remote locations we've got, so we're fortunate with that. Again, I go back to the hospitals. They're very much up and running. We're trying to figure out how do we partner with them to try to figure out what are we doing as far as getting more testing available. We're working with our health department, and I know we have a plan for that as well, working with our health department to figure out how do we get that funding now that we do have some.
Yeah.
To get the testing for some of these other locations and people that I guess are more vulnerable population, if you will.
Mark, we've been a little bit more fortunate than some of our regional partners. Obviously, the city of Detroit, the contagion and spread there, Wayne County, some of the hotspots that they've had, Oakland County with regards to the larger spread that they've seen too. We've been able to manage the surge capacity from the hospitals, not only with the testing avenues here. We've been fortunate enough too with some of the private testing opportunities that have popped up, obviously with the Rite Aid behind us here on the screen. A couple of urgent cares have popped up too. What we've been doing with our local health department is we've been looking at an internal strategy helping those vulnerable populations as far as some of those folks in those senior care facilities, those congregative care facilities, and we've been in continuous conversation with them, not only if some of the critical resources that they need with PPE or getting them support from the healthcare agencies and now scaling up and testing in that area. So Bill Radilla, Dr. Lokar, the entire team there has got a pretty robust strategy that's not only going to inject a tremendous amount of testing in those areas, but ensure that if there's any critical hot spots that do pop up, we have testing, we've got the contact tracing, and we're going to be able to respond. And then again, it's that containment strategy, Mark. We're also looking at some more larger options, whether it's the partnership with the healthcare agencies to bring in some more of those advanced testing elements, whether it's new testing machines, some of that quick testing stuff, and even some of those antibody things. All of those are in the conversation. And if you go to macombgov.org and you need a test or you're looking for a test, again, you can get that information, find a test site, and still be able to connect with your healthcare provider.
Yeah, we do get that call once in a while. Somebody will try to get a hold of us or contact us and say, where do I get a test? All that information, as JP just got through mentioned, macombgov.org. They've got a list of every one of them, whether you have some type of health insurance or don't. We have locations here in Macomb County that'll support you or help you out. Back up on the screen here, that's that Rite Aid. We keep it up here in our command center here, just to kind of get a feel for what's been happening as far as people actually testing. And as you can see, there's still a lot of people that are going there. So that happens to be a Rite Aid. It's a private, endeavor. And what they're doing is allowing people to register online. They can show up there, they show them how to do the swabs, and they take care of themselves. So we recognize that they've been getting a pretty good flow of traffic in and around that area as a test site available to the public. And again, My Care down in the Centerline is a great location for people that maybe do not have medical insurance. So we've been able to try to figure out how do we meet that need. We're going to expedite that, getting into some of these other alternate care facilities that are in and around Macomb County. To try to figure out how do we meet their needs as well. We don't run those facilities, but we're trying to figure out everything we can do to support them to get these tests done.
Mark, you talk about support. We're in constant conversation with all those test sites around the county. We got in some intel from the folks that are facilitating the Rite Aid site. Their peak day had over 250 tests at that site and no issues with regards to capacity, ingress and egress, or service. So again, we're meeting the need in our community through a lot of these alternative means, orchestrated not only through our health department and the capacity that we have, and again, looking at other abilities to source the appropriate material and get it out through the best channels in our community.
And again, we're going to try to keep you updated, get you all the information you need to go to macombgov.org so you can find out what areas are in need of support. Maybe it's somebody that needs a donation. Maybe there's something there you can volunteer for. The information is there continuously about what's going on as far as the numbers, as far as deaths, as well as people that have tested positive, and other resources. So we want to thank you once again for tuning in. Again, keep yourself and your family safe.